Good afternoon, everybody. We're back to a journey in autism. My name again is Katrina, and today we're going to talk about the diagnosis appointment. So, a little recap on the last video, I discussed about going to the early steps program regarding our baby Asia, and that's the place where they pretty much do the 4-hour evaluation. They give you a lot of referrals. They let you know, okay, it could be A, B, or C that's going on with your daughter. Just once again, it was because we had a 3-year-old daughter. Now, at that time, she was 2 years old, that had a speech delay. So we were trying to find out, like, what is the cause for this delay at this stage. And so at this point, as far as of her story, we've already had those evaluations done. They gave us referrals to speech therapy, occupational therapy, which has to do with gross motor and fine motor development. And we already had gone to a neurologist. They did brain, well, no, at that point, actually, we had not gone to the neurologist. We got a referral to see a neurologist. And it was after this appointment that I'm going to speak about today that we did wind up going to actually do the neurological exam and things like that. So let's get started. So we received a referral to see, I believe it's a behavioral developmental pediatrician. I may have something mixed up with that, but it was that doctor that Asia went to see. They told us that if you see this lady, she will know what's going on with your daughter within 1 hour. So I had been calling. She was super booked. I was calling her assistant to find out if it was any cancellations, and we finally got in. That appointment was on June 1st, 2018. So when I went, it was not a huge deal for me at that time, although I was experiencing a little bit of anxiety. If you watched the previous video where I was talking about Meet Julia, the Sesame Street little segment that they had about a little puppet that had autism. And I saw that actually like 2 or 3 days before this appointment. And once I saw it, I saw so many signs that my daughter was displaying. So it started to kind of stir up a little bit of anxiety in me. But I was like, it's okay. I'm still going to go. It may not be that. It might be something else. So nevertheless, we get to the appointment. The lady was very nice. She spoke very calmly and pretty much like a monotone little voice or whatever. And she asked me a lot of questions. At first, she told me she was going to be evaluating Asia. She had like a play area in the corner, and Asia was doing stuff with her assistant. And but she also was going to be asking me questions about Asia, about things that I've noticed about her from birth. Some questions about when I was pregnant, how my pregnancy went, what type of birth did I have? Was it vaginal or C-section? And I did explain to her it was an emergency C-section and things like that. And after she asked me all of those different questions, she gave me about 5 minutes. She told me she was going to be right back. She had to go and discuss her findings with another individual or several individuals. They were watching us behind a glass just to, I guess, come up with whatever their view was of her case. And they did tell us in advance, like, hey, these are people are over here, they're going to be evaluating you guys behind the glass or whatever, just so we would know. So it wasn't like they snuck and did it or anything like that. And so when she came back in the room, she asked me one question. She said, okay, Mom, so what do you think is going on with Asia? When she said that, it literally like took the breath out of me, because when she asked me, I knew she already knew what was going on with her. And then also by the questions that she was asking me when she was evaluating Asia and evaluating her through me, asking me questions about her, I was just like, yeah, she does do that. Oh yeah, she does, do this or what have you. And it just like, I knew she knew what was going on. So it was kind of rhetorical when she asked me the question. And I started crying. Like I literally like just broke down right then. She hadn't even told me the diagnosis or anything like that yet. And now that I look back, I can smile about it because it's just so crazy how she knew. And of course I know these people go to school for a long time and stuff like that, but I'm just so grateful now looking back at it that I did actually go through and get to her at the time that I got to her. And of course she did go ahead and tell me she believes that Asia has autism spectrum disorder. She explained to me what that was. She also told me that she felt like she had sensory processing disorder, which is autism, for those that may not necessarily know, it's basically a brain disorder. And if you would like to know the full details of that, I would suggest googling it because I'm not an expert, but it's just she does things that she learns in a different way for the most part. And also sensory processing disorder, which has to do with all of her senses. She's very sensitive in her feet, in her hands, just everything, even her mouth. Far as I've been noticed, like brushing her teeth and stuff was hard, because she would seem like it was too much for her at times. So she broke it all down to me, and she did talk to me in a way that was very serious, which made me uneasy at first. And I've gone back to her a couple of times since that diagnosis, and I told her, I was like, man, you kind of scared me when you gave me the diagnosis. It's just you talked to me in a way that was just so serious, and it made me nervous and feel more anxiety. But I told her I'm glad that she did it now that I look back on it, because it let me know a sense of urgency. She told me, it was good that she was diagnosed, which at that time she was 2 years and 3 months. She said it was early intervention programs that were available for Asia, and that it was a great time for her to be diagnosed so that we can hit the ground running with all of these different therapies that can help her to live a very productive life and hopefully to be an independent individual, in the long run. And so I'm glad that she spoke to me in that way, because if she had not, then I probably would not have taken it so serious to just hurry up and just get everything else going, to get more therapies and stuff set up for her. She did recommend ABA, which is applied behavioral, I believe, analysis therapy. And she said that would be like the most important therapy for her, and it's really good. Once she can get started with that, then I would see improvements pretty fast. And I will say, at this point, Asia has been receiving that type of therapy for a year now, and she was absolutely right. It's been phenomenal. I would definitely talk about her behavioral therapist in another video to come, which they're awesome. And it made a big difference. Even in like 4 months, I already saw different stuff that they taught her that I know I could never have taught her how to do, and just with her overall behavior and things of that nature. So she did recommend for Aisha to also go see a neurologist, which I did receive a referral for her to see a neurologist from her primary care physician, but they were telling me at early steps it may not be necessary for us to come see this particular doctor first that diagnosed her. And she did recommend for genetic blood testing, just to see if it was something that the autism was something that she was genetically predisposed to have, and also for brainwave tests, EEG, just to see if there's any type of brain damage, because I did have an emergency C-section, and I know that her heart rate was dropping extremely low when I was in labor. So they just wanted to check those out. And even though she had to be put to sleep for the brainwave test, when we did go see the neurologist and stuff like that, everything came back normal. Brainwave test came back normal, and the genetic blood testing came back normal. So there was no the autism had nothing to do with brain damage, nor was it something that was in her genes. So we are happy about that as well. So that was pretty much the gist of that appointment. I left there devastated because I did not know that was what she was going to tell me. And at that time I was very green pertaining to autism. I didn't really understand it. She gave me handouts and referrals and a lot of different people for support, like CARD Services, Center for Autism and Related Disabilities. They're like a resource and referral organization for individuals that are on the autism spectrum, and they have been quite helpful. I did register her with that, along with a lot of other different resources and stuff. But that appointment was pivotal. It was like a turning point for me. It was very much like in my face with all this, okay, she has a diagnosis now. But at the end of the day, it was like what pushed me to go ahead and really get serious about what needed to be done to help get my little baby on the right track. So after I gathered myself, which it took a little while, probably not too bad though, like I don't know, maybe about a week or so, then I started to contact the other agencies and people, that therapists and stuff that she recommended, to try to get things set up. And so that will be all for this particular video, just about the diagnosis. I'm calling it D-Day. But even though it was tough for me, it was good, so that we could get her on the road that she needed to be on to make improvements. And time was of the essence. So I am grateful in hindsight. Back then I was mortified, but now it's okay. So if anybody is watching this video and you're receiving a diagnosis for your child or what have you, it might be scary at first, but I'm here to tell you that if you can push past that fear and still take action to get those children in the therapies that they need as quickly as possible, you will not regret it. So I do thank you guys for watching, and I apologize for not being able to get content out as quick as I would like, or as quick as I've said I would. But I do plan on doing better with that. It's just been so much going on with Asia. So in the next video, I would like to discuss the behavioral therapy, the process that I took to get her in that therapy, and how like the first days of therapy went. I think that will be very important for those of you that are not very familiar with behavioral therapy. And once again, I do thank y'all for watching. Make sure that you subscribe and like, and feel free to share this video and all the other videos with anybody that you feel like will be able to benefit from this. I'm very informal with these videos. I just record them myself at this point because I'm not really interested in the view of it all. I'm more so interested in sharing my story and Asia's story with those that need to hear it. And I just want to help. I just want to be a point of reference for somebody, because I don't feel like I had that point of reference when it was my time, for all of the newness that comes along with this type of diagnosis. So thank you, and you guys have a great one, and we'll see you again on A Journey in Autism.